Today we're going to talk about the State Tested Nursing Assistant Program, and I'm joined today by Nakia Burrell. Today we're going to talk about the State Tested Nursing Assistant Program. We have this training here at Tri-C, and I'm joined by Nakia Burrell, our trainer for this program. Thank you for being here, Nakia.
Thank you for having me, Ashley.
So I really appreciate it. Every time I do one of these interviews, I get to learn so much more about, these topics, what we offer here at Tri-C. And I also get to learn about, your career and your path. Because I think, every time we get a little piece of someone, it helps us on our own journeys as we consider our paths going forward.
Absolutely.
Yeah. So thank you so much. First of all, could you, explain a little bit about what a state tested nursing assistant is or does?
Yes. So a state tested nursing assistant is practically in the name. So they've received a certification from the state that they're in through a series of testing, through a series of test questions and clinical evaluation to become a nursing assistant. So the role of a nursing assistant is to, long and short, assist the nurse in what usually is a skilled nursing facility. It can also be a hospital setting. It can also be a home care setting, and so various settings. And so they assist the nurse with different procedures, activities of daily living with the residents, such as bathing the resident, grooming the resident, ensuring dignity, giving them a better quality of life. Maybe the resident or patient has had a decline in mobility, so dressing the resident, feeding in some cases, recording vital signs for the nurse before a shift, various procedures, various skills that are very helpful in the healthcare setting to the nurse. It's a really important, very important job.
Yeah. Wow. You named so many different things. That takes a big team to do for the care, especially people that are in round the clock care. I can think of so many situations, even, my own family members that have maybe encountered an STNA, whether in the hospital or in home care. So, what led you into that field? If you could talk a little bit about that journey. And then after that, I'm going to ask you, where that's led you since.
Okay, good question. So for me, it was something early on. It was something that I may have emulated from my grandmother, who was just a wonderful person and a wonderful caregiver. I saw her doing these things for her brothers and sisters and just friends. And so I think it just became something that was caught or taught to me. So really early, I knew that I wanted to have a career in nursing. And so at 18, right after high school, right after I received my diploma, I went right into an STNA program that was provided by a facility. A facility had a program, and one of my family members said, "Nikki, this is your chance. Let's get you signed up." And I hit the ground running, and the rest is pretty much history.
And wow, you talked about so many cool things along that journey, seeing someone else who had that passion for care that was instilled in you from your grandmother, but also that you had this support of family members kind of pushing you into, bettering yourself, bettering your career.
Correct.
Wow. And that gives you so much affirmation, right?
Yes.
As you're looking towards that field.
Absolutely. So much affirmation. And when looking back, it's so much to be thankful for that I knew that I was headed in the right direction. And I felt like I had a career where I was always useful to the world.
Wow. That's so important, right? Mm-hmm. I think every person tries to look for purpose along their journey, right?
Yes,
you want to make sure you know what you're doing, why you're doing it, and have reason behind it.
Wow. Absolutely, Ashley.
Yeah. So tell me a little bit more, you entered the STNA field, and there are some people that could do that for life. It can be a lifelong career, but then there's also places where you can go where your career can continue on with those skills, right?
Absolutely. I see it every day in the class as I facilitate and instruct these students that are in front of me. Very bright students. Sometimes I see them in high school as a means to enter into a nursing program or enter into a medical program. I also see it with my students who have already had a bachelor's or a master's and they're starting a business now,
Oh,
and a
wow.
healthcare business, and they're saying, I want to be knowledgeable about what it is that my workers are going to do. So there's a variety of people that you encounter who want to know these skills, who want to gain these skills to become an STNA and to get into this workforce to make a difference too. I knew on my path as well that this was a road that I needed to be on to fulfill my dream of becoming a nurse.
That's fantastic. And so, yeah, tell me a little bit more about that. You became an STNA, and now
Yes.
you're a nurse. How
Yes.
was that journey?
The journey was wonderful. It really prepared me for the nursing field. When I went in, I knew the basic skills. I knew what were the foundation and the fundamentals of nursing. It really did prepare me. I was an STNA for about 4 to 5 years before I became a nurse. I went to school and worked as an STNA part-time because it is a 24-hour, 7 days a week, 365-day career that allowed me to work around my school schedule. There was, never a time where the facility or, hospital was closed. So I always had that opportunity to choose the times that I could work when I wasn't in school. And it was
Wow.
also gainful employment for me. It also meant for me and to the company that I worked for that they had an employee that would benefit them by becoming a nurse, attaining more education. And so it was always a win-win situation for me.
That's fantastic. And like you spoke about the employer factor, how nice is it to have someone internal that you can see rise through the ranks that understands your
Yes,
system, the way things are managed, and, really can then bring up the people that
yes,
are on that team that are also along that same journey.
absolutely, absolutely.
Yeah. Did you feel, you talked a bit about how your grandma had instilled in you, this caring for people, this
Mhm,
compassion for people. That's
mhm.
obviously a huge skill. What other personal skills do you find are really helpful in this career?
Other than the compassion, personal skills, I think being empathetic,
Mm.
putting yourself in the position to say, what if this was me? What if this was my loved one? What if something happened to me? How would I want somebody to treat me? How do I want people to talk to me? So I think the golden rule is primary in in this career and in this field.
Yeah. And it's so funny, that golden rule, right? It's something that
Hmm.
we've all learned as kids, but yet you
Hmm.
can see it right up in front and center in this field where you are
Yes,
caring for individuals. You're also talking to family members. You have to show a
absolutely.
lot of compassion, right?
Absolutely. Talking to family members. And that's a great point, Ashley. It's not just about that resident, it's about that resident's family members. It's about that resident's husband, daughter, wife, sister, brother. It's working together with the whole team for that patient. And that's really exciting too.
Yeah. So as you were going along in this career, could you share with us any challenges or surprises as you started along that STNA journey?
Well, in the beginning, I had quite a bit of challenges when I first became an STNA, straight out of the class, straight after state testing. One thing that I encountered that was difficult for me was the process of death and dying.
Mm.
So it seemed to me that as soon as I hit the floor as an STNA, that I had a lot of patients that were dying. They were already going to die, but I was so new in the career that I wasn't able to identify that and I did not know that. So as you become acquainted with these residents and these families and have these attachments because you've invested this compassion, you've invested this time, and then this person is just going through a normal process of life, but they die.
Mm.
And so I had that happen early in the career, within weeks within my career. And I thought, this can't be for me. But it took other team members, other STNAs, other nurses that was able to come along and strengthen me and say, this is part of the process. And you're here for a reason. You're here because these people need you. You're here because this was part of their process and you get to be a part of their process. So that led to other things later on in life in the nursing career, including hospice and being able to be there at end of life care.
Thank you for sharing that. I think sometimes
Welcome.
it's hard to share about our struggles, but, as you brought us along through that illustration from your own life, there's a lot of, in a way, pride that you can take at the end of that from what I was hearing, that you get to
Absolutely.
be part of that journey and
Right.
even part of that strength or relationship building for individuals going through a tough time.
Absolutely. Absolutely.
So with that, what are some of the day-to-day things that you loved about being an STNA that really led you into that nursing career as well?
Day to day, for me, the camaraderie between the other STNAs that I was working with, you gain these friendships that are lifelong, being inspired by, at that time, looking at nurses, knowing that this was where I wanted to be. That was inspiring for me. Having an honest career, having a fulfilling career every day, wearing different scrubs, that was a thing for me. Dressing up in those scrubs as what I considered a medical professional, being there for those residents, meal times, sitting along with them at their meal times, seeing what they liked, seeing what they didn't like. It was really exciting. I was working in gerontology, so with seniors and elders a lot, gleaning all that good wisdom that they had, all of their life experiences, meeting incredible people was a blessing for me. And so that encouraged me to go and keep going. And because of my patients and because of my residents, I am who I am today.
Oh, that's awesome. I can identify with so much of what you say. You speak to my heart and just like getting to meet new and interesting people.
Yes.
You always carry something with you once you have those encounters, especially as you
Yes.
build relationships, right?
Absolutely, Ashley.
Yeah, that
Yeah.
is so cool. So as we think about like training to become like a state tested nursing
Yeah.
assistant, there's a lot of ground that you cover in the course,
Hmm.
right? It's
Yes.
a lot of information. You have to be prepared for a lot of different things. And I'm thinking right now, even with like COVID-19 and
Hmm.
how much,
Yes.
safety and, infection control and those sort
Yes.
of things. So, what if someone was entering the course and the training, what type of subjects do you think they need to kind of expect?
Well, you brought up two of the most important, especially in this COVID-19. The safety is number one, making sure that they know how to identify an emergency, knowing how to report that, to communicate that with their nurse. What does it look like when you see certain signs, or what we call clinical signs or clinical symptoms, coming into this field? That's important. The STNA students that I've been facilitating and training, they're very sharp, they're keen. We talk about how to identify objective signs and symptoms, or objective information, things that you see, things that you smell, that you touch, that you taste, that you hear, things that people are saying to you, especially in these times of COVID-19. What
Mhm.
is that patient saying? Is that patient more tearful now because right now the policies that they have in place, these patients aren't, or residents aren't able to see their family members? So, the difference between a resident saying, oh, I'm fine, but they have tears welling up in their eyes, or you know that they're less talkative, they're communicating less. So I think that those, what we call initial identifiers, that an STNA will be able to to notice is important right now in the COVID-19, along with infection control, learning how to break a chain of infection. Right now, we know that hand washing is precedent. So we teach you how to break the chain of infection through hand washing, wearing the personal protective equipment, knowing which personal protective equipment to wear. You learn all of this stuff in the STNA program. For the students that were in my latest classes, it was just a perfect time as COVID-19 hit and more information needed to be relayed. Those students felt empowered that they were the ones that were on the front lines for their families, for their friends. They had real relevant information. And in that short time, they became heroes for their families. It's amazing. It's amazing, just to name a few things.
Yeah. Wow. And that's such a good illustration of how much that knowledge is so beneficial, not just in your job, but personally. A friend that's a nurse, and I've been texting her weekly throughout all
Yes.
this, just getting those updates, because
Yes.
in a lot of ways, she's who I would trust on
Yes.
what's coming out. There's so
Yes.
much information out there. You just want to make sure you're
Absolutely.
doing the right thing.
Absolutely. Absolutely.
Wow. And I know it's also always important to touch a bit on mental health and social services and an STNA's role in that.
Yeah. So mental health is important too. I'll kind of elaborate on, well, mental health for yourself first, okay? Knowing when you need a break, knowing when you might be working too much. What are the signs and symptoms? We teach and we facilitate and help you to understand what are signs and symptoms for the worker, for the STNA. When have you had just a little too much? When do you need to kind of pull back and take a little break? Because there is a major mental component that goes along with being an STNA. So knowing what that's like for you, because if you're not well as the STNA, you can't give what you don't have. So as a nurse, I always try to help my STNAs understand their limits and help provide boundaries for them as well. So in return, the STNA can also help identify with the patients or the residents that they're working with, the mental health aspect, the various different mental health aspects, such as real diagnoses of mental illnesses, real diagnosis of Alzheimer's or dementia diseases. What do you do in this case when somebody may not be in what's considered the social norm?
Mm-hmm.
How do you handle and how do you work with that patient, or how do you work with that resident? How to identify if a person was at baseline normal and then all of a sudden you see their mental status change. And so we teach the STNA how to identify factors and how to have interventions with those mental health aspects. And so in social work, they play a huge component in this as well. We talk about a lot, and we teach the STNA about how to work with an interdisciplinary team, a social worker being one of the primary people on that, knowing that it's not just for the STNA and for the nurse to be able to solve these problems, but we have a whole team that we can collaborate with, that we can work with, that we can draw from in order to provide the appropriate resources for patients and residents. And they have a ton of them out in the community.
Yeah, and I love that you touched upon that, because it's not just one person's job. You're there, and if you observe something that is out of the norm, it's definitely your job to communicate that. But beyond that, I mean, there's so many resources, and that's what's exciting about being able to help that individual, is that you help facilitate that next step, right?
Absolutely. And especially at Tri-C, Tri-C gives you really good ground to get the resources that you need. It's unbelievable how much Tri-C helps not only the student, not only the instructor, but also the community to be able to have those resources.
But
Absolutely.
that's really cool. And then when you're done with the program, there's an exam you take, correct? And is it through the state?
Yes. So after you finish the 75 required hours that are required by the state, there is a certification that you receive, and then you have and especially at Tri-C, I want to say this, Tri-C pays for your state testing.
Oh,
They
wow.
also provide an exam review of skills and of theory, absolutely free. You can do the review as many as times as you need until you feel confident. Let's say you took a class 8 months or a year ago, and now you feel that you're finally ready to test. You can come to one of the review classes so that it's going to prepare you to come to one of our sites, because we do have sites, state testing sites at Tri-C, where you can come and do your state exam.
That is so helpful too, to know that you have that support as you're going
It
into
is.
the exam. I think so
Yep.
often we all get that test anxiety and we
Yep.
know the information, but
Yeah.
it's having that review and feeling
Yeah.
confident when you walk in that room.
Absolutely. And Tri-C prepares the student from start to finish very well.
Well, I just have to say, it's been such a pleasure speaking with you
Thank
today,
you.
Nakia.
Thank you. It's been my pleasure speaking with you.
Thanks. Well, you can come on anytime. We'll have to do another
Thank you.
sometime.
Awesome. Absolutely.
If anyone out there listening wants some more information, we'll have a link in the text above. Thank you so much.
Thank you.